I'm Michelle Frisco, and on behalf of my co-planner, Dorothy Daly, we want to thank you all for coming here today to be a part of our first meeting, Building Bridges to Improve Population Health. We are really thrilled to have you all here. This is our first meeting convening a diverse population health researchers, practitioners, and policymakers, and we're hoping that this will encourage more bridging across disciplines and across sectors. We have a great program for you today. We're so thrilled at the vast, broad, interdisciplinary group of speakers who have agreed to participate in the program. And so we're really thrilled and want to thank you all for being here today. Before I give just a few thank yous and opening remarks, I just want to go over a couple of logistical issues. First of all, if you haven't discovered, there is Wi-Fi in the building. If you're asked for a link, you just click on the visitor tab that should come up on your phone. So you will have Wi-Fi capability. There should be coffee and tea in the Great Hall. That's the really beautiful room right outside all morning. Lunch will also be set up in the Great Hall at our lunch break, and you can eat lunch in the Great Hall, in the West Courtyard, or in the East Courtyard. And basically, if you haven't figured out yet, this building is largely a giant U, and so you'll have one courtyard on each side of the building. And then I also wanted to note that the current sessions following the plenary panel will be either in the lecture room, which will be, when you come out of the auditorium, that will be to the hallway to your left, or they will be in the National Academy of Sciences room 120, and that will be to your right and up the stairs. And finally, we hope that if your flight or travel plans don't mean that you have to leave early, that you'll be able to join us for a closing reception today from 5 to 7 in the Great Hall. And so, like I said before, we really want to thank you for being here, and you might be wondering who we is. And I have to tell you, it has really taken a village to pull this meeting together, and so I need to thank a really great group of people for helping ensure that we can all be here this morning. So I have to first thank a fantastic planning committee. Doug Judy, Tamar Mendelson, Carlos Mendez de Leon, and Meredith Barrett were really wonderful to work with on this meeting and pulling the program together. We also couldn't have convened this meeting without the generous support of the Robert Wood Johnson Foundation. They've been wonderful to work with. We're fortunate to have their support and to work with Matt Trujillo, who's been great at helping us plan the meeting and helping us manage the grant. I also have to thank Penn State's Population Research Institute and the Institute for Policy and Social Research at the University of Kansas for supporting the meeting. And then we wouldn't be in this wonderful space without the IOM Roundtable on Population Health Improvement and the National Academy of Medicine who are hosting us here. So thank you very, very much. And I especially want to say that I'm grateful to the support of all the Roundtable members and the co-chairs, George Isom and Dave Kindig, and also Paula Lance, who is the meeting organizer for the Roundtable meeting tomorrow, which will also be convened here, and it's Advancing the Science to Improve Population Health. We know that several of you will be sticking around for that meeting too, and it should be really fantastic. And then I also want to thank Colin Fink and Alina Bachu, who have been wonderful. They've been on the ground support here, helping us make sure that we get all the logistics correct in this building. And then I also have to definitely thank the executive board of the Interdisciplinary Association for Population Health Science. Without them, this meeting absolutely would not exist. This meeting came as a fruition of all of our efforts. And Dorothy and I are members of the board, and we've also been grateful to the support of the other members who have helped us pull this meeting together. And those members are Yannette Thomas, Gerard Lebeda, Chris Backrack, Jose Pagan, and Mark Hayward. And finally, I want to thank Carolyn Scott. She's been our wonderful logistics on the ground support at Penn State. She's been great at helping us plan all the meetings. This meeting and building a strong interdisciplinary population health community really does take a village. And so if you haven't already done so and you want to keep being a part of the village, when you walked in the door, there was a place to sign up to be on the mailing list for the Interdisciplinary Association for Population Health Science. So as long as you give us permission, we will send you updates about the activities that are planned after this meeting. And I also want to say this village absolutely does include every one of you who came to participate today. This meeting couldn't be a success if we didn't have a great group of people here to participate in dialogue. So thank you very, very much for being here. And I just want to make one last note, just so you can put it on your calendars now, that there are 2 more planned meetings in the works already. Next year, September 19th to 21st, we'll meet at Penn State University at the Nittany Lion Inn for the second meeting. And then in 2017, in September or early October, we haven't quite solidified the dates yet, it's a little bit too early to do that, we'll be at the University of Texas at Austin, and the UT Population Research Center and the Rice University Kinder Institute for Urban Research will be co-sponsoring the meeting with us. And so I'm so grateful to the support of all of these wonderful institutions for bringing these meetings together. And now I'm going to turn it over to the first session. I'm going to hand it off to Bruce Link, who's Distinguished Professor of Public Policy and Sociology at the University of California, Riverside. So take it away, Bruce.